Governor, expensive visiting nurses, utilization of COVID-infected medical personnel, an expensive National Guard deployment. Why won't you simply hire fired medical workers, by the way, who are still frozen out of unemployment compensation, with a proviso that they are aggressively tested?
Repeat that, please, Pat. I didn't quite get it.
Sure. Again, expensive visiting nurses, utilization of COVID-infected medical personnel at state hospitals, an expensive National Guard deployment. Why won't you simply hire fired medical workers, who, by the way, are still frozen out of unemployment compensation, with the proviso that they are aggressively tested?
Yeah, so right now the protocol is that you need to be vaccinated to work in the healthcare industry. That's what we've got in terms of a regulation, and we're following that right now. So it's fairly easy answer to that question. I would add, though, that there's multiple ways that we're working on to relieve the stress in the hospitals, and I outlined many of those in what we talked. But you know, it's either getting more staff in, have less hospitalizations. That's why we're talking about the vaccinations, both the doctor as well as the lieutenant governor, everybody up to the microphone, and also having getting people out of the hospital as soon as we can. So we're working on strategies, including the preventative details that the doctor spelled out. And right now, the protocol is that you need to be vaccinated to work in the healthcare. Well, again, I'm not. I'll let somebody else speak to the details on that. But my understanding is that it would have to be a dire emergency to get into that spot. So, I would say again, we're following through on the current protocols in terms of vaccination, and then we're working our way. And I detailed quite extensively in my comments about the partnerships that we're developing with our universities, with the National Guard, with the Department of Health, with our local municipalities, getting emergency, our rescue and our EMTs on board in terms of being able to cover timeframes, and we'll continue to work on that level. But the executive order is in place in terms of vaccination and healthcare.